Magandang araw sa inyong lahat and welcome to our third pre-recorded video lecture for the subject Clinical Practicum 101B. I am Dr. Reburon, your instructor, and I will walk you through the common complications in the third stage of labor. This module is going to be very important for you as a midwife because you will be made familiar of the common complications that arise during placental delivery. So I will be teaching you the different medical and obstetrical complications that may arise during the third stage of labor and delivery. Remember that it is vital that you learn all these concepts so that you can prepare yourself to manage these complications if ever they arise and if ever you meet patients displaying these common complications. So the first common obstetrical complication in the third stage of labor is what we call retained placenta. We have already discussed this in your second module, and now we will scrutinize what really is retained placenta or retained placental fragment. Now, retained placenta is generally defined as a placenta that has not undergone placental expulsion within the 30 minutes of the baby's birth. So simply put, pag yung placenta po ay hindi lumabas after 30 minutes after the baby's birth, then we already consider that retained placenta. As you know, the placenta should only be delivered within the first 30 minutes after the baby's birth, and if the patient fails to expel the placenta within that span of time, we already consider that as an abnormality. So it is also defined as a condition in which all or some parts of the placenta or membranes remain in the uterus. So when we say retained placenta, it doesn't necessarily mean that there is only a tear or a cotyledon that has not been expelled by the mother. It may also mean that the whole placenta is retained inside the womb of the mother. All right. So a retained placenta is commonly a cause of postpartum bleeding and infection. Like what I told you last time, when a placenta is not expelled by the mother, the uterus will continue to become relaxed. Thereby, this will cause bleeding and possible infection. So as midwives, it's important for you to be wary of the signs of retained placenta so that you can immediately report the condition to the doctor so that the doctor can either perform dilatation and curettage or manual evacuation of retained placenta. So we also have the term retained placental fragments, and this refers to the incomplete delivery of the placenta. It may be that a portion of the placental cotyledons are left inside the uterus of the mother, and also, this can cause continuous bleeding, relaxed uterus, and infection. So you have to remember that when we refer to retained placenta, it is the failure of the placenta to be passed on the first 30 minutes after the delivery of the child. But when we say retained placental fragments, this means that a portion of the placenta is not expelled by the mother and is retained inside the womb. Now, this is what it looks like to have a retained placenta after the birth of the baby. So as you can see, there is a portion of the placenta that is lodged on the lower uterine segment. And now this will continuously drain blood from the uterus. Thereby, it will cause the whole uterus to remain relaxed. And it can also cause bleeding or postpartum hemorrhage to the mother. So like I said, you have to check for the placental completeness after the delivery of the placenta, and you have to look for the cotyledons. There are 16 to 18 cotyledons in one placenta, and if you see tearing or if you see a membrane that is lost or incomplete segments of the placenta, the doctor should be immediately notified. Okay, we proceed to the next slide. Now, what are your midwifery responsibilities when you see a patient with retained placenta? As a midwife, you are expected to, number one, not forcefully tug or pull the umbilical cord just to deliver the placenta. As I told you last time, a midwife that is prudent should not be tugging or pulling the cord forcefully just to deliver the placenta. I have told you last time that if there is resistance, pag hinihila mo, ayaw lumabas ng placenta, hindi mo siya dapat pinipilit. Why? If you forcefully tug or pull the umbilical cord, there might be tearing on the placental cotyledon. So hindi maganda yung separation ng uterus from the placenta, and that will now cause the tearing or the retained placental fragment. So sabi dito, if there is a tension or resistance, it means that the placenta has not yet properly separated from the uterus. And what should you do kung merong resistance or tension while you are applying cord traction? Habang hinihila mo at nakikipaghilahan si placenta, the best thing that you can do is just give it time. Give it around 2 to 3 minutes, and then you wait for the uterus again to contract. And then you try to pull it again, but this time gently. So after 2 to 3 minutes, makikita mo maglulusen yung umbilical cord, maglulusen din yung placenta. So even without tugging or pulling it forcefully, lalabas at lalabas pa rin si placenta. So that's one of your midwifery responsibilities, to never forcefully tug or pull the umbilical cord. Next, you should never apply pressure to a postpartum uterus that is relaxed or non-contracted. So it is very important to note for the presence of uterine contraction when you deliver the placenta. Bakit? Kasi if you still apply pressure on the uterus, if it is still relaxed, tendency is this may cause the relaxed uterus to also evert, or what we call turn inside out. So dapat yung pasyente natin, when we deliver the placenta, they should be displaying signs of contracted uterus. So one of your midwifery responsibility is also not apply pressure on the postpartum uterus that is relaxed or non-contracting. Another midwifery responsibility for retained placenta is tugging or pulling the placenta forcefully can also lead to the tearing or laceration of placental cotyledons, I told you a while ago. And these placental fragments that are left inside the uterus may cause continuous bleeding. They can cause relaxed uterus or even infection. So after the delivery of the placenta, the first thing that you're going to do is inspect the placenta for its completeness. Do not immediately discard the placenta. Hindi agad-agad yan nilalagay natin sa bin or sa basurahan. We have to inspect the maternal aspect of the placenta, or the dirty side, or what we call the Duncan presentation, for us to determine if there are missing lobes or missing cotyledons. If in the event that you see placental cotyledons that are missing, immediately refer the condition to the attending physician. Kasi if you do not perform the inspection of the placenta for its completeness, you will just immediately assume, ay, kompleto yung placenta. Yun pala, merong mga missing cotyledons, and that will now lead to the bleeding. So pag hindi mo siya in-inspect, the doctor will become clueless as to the needs of the patient. So hindi alam ni doctor na may mga placental fragments pala. And whose fault is it? It is yours. Kasi you did not perform the inspection of the placenta. So I'll repeat ha. The other midwifery responsibility after the delivery of the placenta is inspecting the placenta for its completeness. Next, how do we manage retained placenta? So in the event that you see a patient who has retained placenta, who is manifesting signs of postpartum bleeding, meron siyang relaxed uterus, what should you do? You do the following steps. Number 1 is do not attempt to further do controlled cord traction. Pag hinihila mo yung cord kunwari, and then na-feel mo na merong nag-break, meron kung waring, mafe-feel mo naman yun eh. In your hands, you can feel if there is a torn cotyledon. Mararamdaman mo yun. So, in the event that you are delivering the placenta and you already felt a laceration that occurred, do not perform cord traction. Stop what you are doing. Instead, performing the CCT may lead to uterine involution or tearing of the placental cotyledon. So, wag mo na siyang hilain because it will only aggravate the situation. Next is you follow the instructions for pre-referral treatment to transfer the woman to a health facility for emergency care as quickly as possible. So, kunwari, you are attending a delivery of a mother inside their home. You're performing home delivery, and you felt that the placenta has torn or has a cotyledon that's broken. Immediately prepare yourself for referral to another healthcare facility because you will not be able to manage this complication alone. You will have the need to ask assistance from an attending obstetrician or gynecologist. So dapat i-prepare mo na yung sarili mo, i-prepare mo na din yung patient mo for transfer if you are performing home delivery and you notice the signs and symptoms of retained placenta. Next, trained healthcare providers may do manual extraction or evacuation of the retained placenta or retained placental fragments. So I have to put an emphasis on the term trained. You have to have training before you perform manual extraction of retained placenta. Why? Because in the event that you have a patient with retained placenta and you have a training, when it comes to removing this retained placenta, the midwife will insert the whole of her arm inside the vagina of the mother, up into the cervix, and then up into the uterus. And the fingers of the attending midwife doing the manual extraction will scrape the uterus of the mother to remove the placenta. I think I have a picture here to show you. So this is how it looks like. The midwife will insert the whole of her hand. Okay? Buong kamay po ang ipapasok ng midwife sa matres ng nanay, and then she will scrape off the retained placenta using her fingers. This is one of the functions of the midwife if and only if she has undergone training to do such thing. But if you are inexperienced when it comes to the removal of retained placenta, never ever attempt to do it alone. You will have to seek assistance from a doctor or an obstetrician. Okay. Next medical complication in the third stage of labor is what we call uterine inversion. I believe that we have we have an Ilocano term for this, and this is butilaw in Ilocano. So when we say uterine inversion, it is a condition in which the uterus turns inside out. So ibig sabihin babaliktad si uterus. It usually follows childbirth. This condition is accompanied by postpartum bleeding. So paglabas ni uterus, babaliktad siya. It will be accompanied by postpartum bleeding. The mother will also feel abdominal pain. The mother will also note or see mass in the vagina. And the mother will also have hypotension and or low blood pressure. So paano ba nangyayari kasi si uterine inversion? If you pull on the cord forcefully, if you are trying to deliver the placenta, hila ka ng hila, hila ka ng hila, and then si uterus nakarelax din, what will happen? Kakahila mo sa umbilical cord, hinila mo nga si placenta, hinila naman niya si uterus palabas. So you did not just deliver the placenta, you also delivered the uterus. And is that good? No, because the uterus is not anatomically located outside the surface of the skin. Dapat nandun lang siya sa loob because the uterus is an internal organ. And if you deliver it and it goes out of the body, that is already considered an abnormality. Right? So like I said, One of the risk factors of uterine inversion is tugging or pulling the placenta forcefully, or sometimes it can be caused by applying too much pressure on the relaxed uterus. So pag pinipress mo ng pinipress yung relaxed uterus, tendency is pinupush mo yung uterus pababa and it will go out of the vagina. This means that there is a risk for uterus to be pulled out of the mother's vagina, thereby it can lead now to your uterine inversion. So how does it look like? It looks like this. So as you can see, the vagina of the mother is located here, and this coconut-shaped organ is your uterus turned inside out. So medically, this is called uterine inversion. Is this good? No. It's very dangerous because the mother will feel abdominal pain, there will be bleeding, and there will also be hypotension. So makikita mo po yan lahat in your uterine inversion. Now, how will we diagnose or how do we make sure that there is really uterine inversion that's happening? The doctor can usually diagnose a uterine inversion easily through assessment. Malalaman ng doktor agad-agad yan, even without laboratory exams. By only using his senses, the doctor can diagnose the presence of uterine infection. So possible symptoms of uterine inversion, I should say, are the following. Number 1, the uterus is protruding from the vagina. So if you do inspection, pag tinignan mo yung vagina ni mother, makikita mo meron kang mass or parang meron siyang what do you call this? Merong laman in the vagina. In Ilocano, adati kasla lasag nga rumrumar from the vagina. And that lasag, that organ, is your uterus. The uterus doesn't feel like it's in the right place. The mother will say, Doc, parang may missing abdominal organ ako. I feel pain on my abdomen. That's the second diagnosis for uterine inversion. Number 3, there is also noted massive blood loss. Maraming dugo ang lumalabas sa uterus na inverted. Number 4, there is also rapid decrease in blood pressure. So kunwari, the mother has 120/80 millimeters per mercury BP when you were attending the delivery. And then after the delivery of the placenta, nakita mo yung BP niya 70/50 na lang or 90/60. So as you can note, there is a massive drop in the blood pressure of the mother. What does this mean? It will prompt you to look at the vagina. Kasi hindi po normal na bumababa yung BP ng ganun-ganun lang without implications. And what is that drop in the BP implying? Ang ibig sabihin yan, that the mother might have uterine inversion. Baka merong inverted na uterus na nagaganap sa pasyente mo. So you have to look at the BP of the mother and compare it to the baseline BP that you got before the admission of the patient. So how do we manage uterine inversion? Sir, paano natin ibabalik yun sa dati? So pwede siyang maibalik, pwedeng hindi. Depending on the timing of the midwife, the uterine inversion can still be remedied. Pero kung masyado nang matagal, the uterus will have to be removed by the doctor from the vagina. So that's what we call vaginal hysterectomy. We will learn about that as we proceed with the topic. So, number 1 treatment for uterine inversion is, you have to remember that treatment should begin as soon as the uterine inversion is recognized. Pag nakita na ni doctor or ni midwife na merong uterine inversion, immediately perform the medical management. Huwag nang maghintay ng kung ano-ano pa. Immediately do it ASAP or STAT. The doctor may be able to push the top of the uterus back into the pelvis through the dilated pelvis. So, anong gagawin ng doctor? The doctor will form a fist. He will ball his fist and then ipapunch niya yung uterus pataas. Okay? Hindi niya forcefully susuntukin ha. The doctor will just position the fist at the level of the uterus na nakalabas or the inverted uterus, and the doctor will gently insert his fist along with the uterus back to the vagina back to the abdomen. So, sir, susuntukin niya? Opo, susuntukin niya gently para bumalik yung mattress sa loob. So, the doctor may be able to push the top of the uterus back into the pelvis through the dilated cervix. I will show you a picture later on. Once the uterus is already repositioned, kunwari na ibalik na ni doctor yung mattress, the next thing that you're going to do is prepare oxytocin. Or, kung walang oxytocin, you can prepare methyl ergomethrin maleate. And what are the purpose of this two drugs? Ang silbi po ng oxytocin and methergine is that they stimulate the uterus to contract. So pagkabalik ng uterus, saksakan mo ng gamot yung mother so that the uterus will remain contract para hindi na siya bumalik palabas. They are given to help the uterus contract and also prevent it from inverting again. So dalawa po yung drug of choice natin in the medical management of your uterine inversion. Number one is oxytocin and the other one is what we call methyl ergomethrin maleate or what we call methergine. So ang function po nila is that they help in the contraction of the uterus to prevent it from ever inverting again. Next. The uterus is also massaged until it contracts fully and the bleeding stops. So, nalaman kanina natin na merong massive bleeding during uterine inversion. So, what do we do? So, pag pinag-contract na natin yung uterus, we also massage the abdomen. That is how we stimulate the uterine muscles to contract and thereby, that will also stop bleeding. And if we try to keep the uterus contracting, it will also prevent the uterus from ever inverting back again. So dapat hindi na nagre-relax si uterus para hindi na siya bumalik palabas. Alright, so those are the medical managements for your uterine inversion. Ulitin natin, treatment should begin ASAP. The doctor will push the top of the uterus back into the pelvis. So parang susuntukin niya paloob yung uterus. And then the doctor or the midwife accompanying the procedure may give oxytocin or methyl ergomethrin maleate to stimulate the uterus to contract, and we can also massage the abdomen to prevent blood loss. So ganito po yung itsura ng pagsuntok ng doctor sa uterus ng mother. So as you can see, this is the fist of the doctor. So makikita nyo, hinawakan niya yung top or fundus of the uterus that is inverted. The doctor inserts it back into the vagina and then the doctor forms a fist. So, cleanse niya yung kanyang mga kamay, and then pinush niya paloob yung uterus. So, that is the medical management for your uterine inversion. Question, sir, pwede ba naming i-perform ito? No. Doctors are the only ones who are allowed to perform this procedure. But if you have special training in the obstetrics and gynecologic center of your hospital, then you may do so if the policy of the hospital allows. Another management for the uterine inversion is that the mother is also given intravenous fluids. So, lalagyan natin ng swero si nanay. Why do we have to do that? I remember that during your uterine inversion, the mother has lost too much blood. Di ba meron tayong massive blood loss? We will have to insert an IV fluid to the mother, preferably plain normal saline solution. Usually it's colored green. Yung ibibigay natin. And we do that because we are preparing the mother for possible blood transfusion. Kasi nga, marami siyang dugong nawala at kailangang mapalitan ito lahat. So, we have to insert an IVF because that will serve as a conduit where the blood transfusion will occur. Hindi po kasi pwedeng sinasaksak na lang natin bigla-bigla yung dugo from the blood bag to the skin of the patient, papunta sa blood vessels. Hindi po pwede yon. We have to create a conduit or passageway of the blood. So, ang ibibigay natin is plain normal saline solution, suero. Doon po dadaan yung dugo na itra-transfuse natin sa pasyente na nag-uterine inversion na nagkaroon ng massive blood loss. Next, The mother will also be given antibiotics. Bakit mag-antibiotics si mother? Remember that the internal organ of the mother, which is the uterus, was exposed to the external environment. So hindi po sanay na na-expose yung uterus sa labas. And remember that the external environment contains many microorganisms. May mga opportunistic microflora po tayo dyan that can lead to infection. And remember po na hinawakan din ng doktor even with the gloves. Kahit naka-gloves si doktor, the doctor manually held the uterus. So ibig sabihin, there is a possibility still for infection because the uterus is something that is kept inside of the body. Pero nahawakan ng doktor. Is that normal? Hindi po. So dahil sa nangyaring yon, the doctor will have to prescribe antibiotics to the patient to prevent infection. This is what we call prophylactic antibiotics. Ibig sabihin, binibigyan na natin yung pasyente ng antibiotics even without the presence of infection. Bakit? Kasi nga it is an anticipatory treatment. Ibig sabihin, binibigyan na natin siya ng gamot kahit na wala pang infection. That is what we call prophylaxis. Alright. So aside from giving IV to the mother and aside from giving antibiotics to the patient with uterine inversion, kung hindi po agad-agad na-catch ng doktor yung uterine inversion or kung wari ikaw na midwife ay tatanga-tanga or kunwari hindi mo ginawa yung inyong responsibility, the patient might have to undergo vaginal hysterectomy. Kasi pag too late na yung medical management ng uterine inversion, wala nang choice si doctor kundi tanggalin yung mismong uterus in the vagina of the mother. So 'di ba nakausli na po yung inyong uterus in the vaginal cavity. Nandun na po siya sumisilip. Pag too late na po yung treatment, hindi na po nagawa yung mga sinabi ko a while ago, ang last resort ng doctor po is to remove the uterus from the vagina. So anong gagawin ng doktor? Ika-cut na niya si uterus. I-detach na niya from the vagina. So ibig sabihin ba niyan, sir, wala nang matres si mother? Yes, that is what we call vaginal hysterectomy. So kaninong kasalanan yon? It's the fault of the midwife. Why? Because midwife's responsibility include assessment and inspection of the postpartum woman. So sir, pwede ba akong kasuhan doon? Yes, pwedeng makasuhan si midwife pag ganito yung nangyari. Because it is the negligence of the midwife. Because it is the duty. It is part of their duty. Pero hindi niya ginawa. So that is a negligence on the part of the midwife. So kung ayaw mong mangyari yung vaginal hysterectomy sa pasyente at kung ayaw mong matanggalan ng lisensya, always remember to perform your inspection. Double check the patient's condition before leaving them because hindi mo alam, they might be experiencing uterine inversion already. Alright. So this is how it looks like to perform vaginal hysterectomy. So makikita nyo dito, this is the vagina. And dito po, sa may iniipit na organ, this is what you call your tenaculum. So iniipit po yung uterus, hinihila na siya palabas, and then the doctor will create an incision here. Ika-cut niya po dito. Ika-cut niya to remove the uterus from the vagina. So ganun po ang mangyayari. Pwede pa bang manganak si patient pag nagkaroon siya ng vaginal hysterectomy? Hindi na po pwede. Another medical complication in the third stage of labor is excessive bleeding. So pwedeng magdugo si mother pagkatapos niyang ilabas si placenta. It is also known as your postpartum hemorrhage or simply put, it's called PPH. Most postpartum hemorrhages are caused by uterine atony. So sinabi natin kanina, a relaxed uterus is a bleeding uterus. So pag nagbi-bleeding yung pasyente, ibig sabihin lang niyan, the uterus is still relaxed. And that relaxed uterus is what we call uterine atony. That is the medical term for relaxed uterus. I repeat, uterine atony is what we call a relaxed uterus or a uterus which fails to contract. Remember that a woman can normally lose 300 to 500 ml of blood during the vaginal delivery. Pwede siyang mawalan ng 2 hanggang 3 baso ng dugo. And that's normal, part of the delivery process. Pero more than 500 ml, that is already considered postpartum hemorrhage or excessive bleeding. So sabi dito, a blood loss more than 500 ml may already be considered as excessive bleeding or PPH. Therefore, this is already reportable to the doctor. So this is what happens during your PPH or postpartum hemorrhage. The part where the placenta and uterus connects remain as an open wound. Okay? So dito kasi, open wound ito. Sugat kung saan nagkabit si placenta at si uterus. If the uterus remains relaxed, ibig sabihin po, yung blood vessels inside the uterus kung saan kumabit yung placenta na nag-absorb ng dugo going to the baby, naka-open yan lahat. And pag open yung blood vessels, bleeding will also occur. Pero pag pinag-contract po natin yung uterus by giving the patient oxytocin or methyl ergomethrin maleate or kunwari, minasage mo yung uterus, the uterus will contract, thereby yung mga uterine muscles, i-close naman niya yung mga blood vessels na naka-open. So, therefore, magsa-stop na po yung bleeding. So, ang pinakamaganda pong ginagawa natin if there is uterine atony is we stimulate the uterus to contract by, number 1, massaging, 2, giving medications like what? Oxytocin and methyl ergomethrin, or number 3 is we also stimulate the uterus to contract through breastfeeding. So pasusuhin na natin yung bata immediately. Pansinin nyo, kunwari naglalabing-labing kayo ng boyfriend nyo and your boyfriend touches your nipple, di ba nagkakaroon ng contraction in your abdomen? Same is true with your breastfeeding. Pag ini-stimulate po ng bibig ng bata yung nipples ng nanay, nag-produce din ng hormone yung katawan ni mother, which is called your oxytocin. Yun po yung nagbibigay ng feeling na nagko-contract po yung kalamnan or lamang loob ng pasyente. So, 3 po yung gagawin natin for uterine atony. Number 1 is massage. Number 2, give drugs like oxytocin and methyl ergomethrin. And number 3 is breastfeeding. So how will we diagnose for excessive bleeding? Sir, paano namin malalaman po na meron na siyang postpartum hemorrhage? Eh di ba sinabi mo po 300 to 500 ml ang normal na blood loss during placental delivery? Eh paano po namin yan malalaman? Eh nandun naman siya sa mga linens. Naka-diaper naman si pasyente. Paano namin malalaman? Pipigain po ba namin? Hindi po natin gagawin yon. So what will we do? Number 1, we can just do visual inspection. Titignan mo lang yung mga diapers, mga soiled linens ng pasyente, and you can already have a rough estimate of how much blood has been lost by the mother by just looking at the drapes. Kung sobrang dugo na nakikita mo sa diaper ng nanay habang nanganak, sa underpad, sa mismong leggings, maraming dugo, it will already give you a rough estimate na baka meron ngang more than 500 ml na bleeding na naganap. But if you are not sure of that kind of assessment, the next thing that you can do is you also weigh the diaper. So anong gagawin mo? Kunin mo yung soiled diaper ng mother and then timbangin mo siya. You place it on a weighing scale. And then kumuha ka din ng isang diaper na hindi pa nagamit. So what will you do? The weight of the soiled diaper minus the weight of the unsoiled diaper is now the amount of blood lost. So kunwari, kinilo mo po yung diaper ng nanay at ang nakuha mo ay 750 grams. Nakakuha ka ng 750 grams sa soiled diaper. And then kinilo mo din yung unsoiled diaper or yung mga hindi pa nagamit, and ang nakuha mo is only 200 grams. So you subtract them and you are left with how much? You are left with 550 grams. So basically, the mother has 550 ml of blood loss already basing on that kind of assessment. Okay po ba? Now, so ito po yung usually na timbangan na ginagamit namin, or sometimes we can also use the spring-loaded na weighing scale. So you'll just have to familiarize yourself with the kind of weighing scale being used in the hospital. So what are the signs and symptoms of excessive bleeding? Paano natin malalaman kung nagdudugo na si nanay? So there are a couple of vital signs changes in the mother who is suffering from excessive bleeding. And these are the following. Number 1, the uterus appears relaxed. Yan yung lagi nating sinasabi. A relaxed uterus is a bleeding uterus. The uterus is relaxed, soft, and uncontracted. Number 2, nagkakaroon din tayo ng changes in the vital signs of the mother. The mother suffers from hypotension or bumababa po yung blood pressure niya. The mother also suffers from tachycardia. What does it mean? Mabilis po yung pagpitik ng puso ng nanay. Nagkakaroon siya ng palpitations. That is also a sign of blood loss. The mother will also experience tachypnea or labored breathing. Nahihirapang huminga or mabilis ang paghinga. Ano pa? The mother will also experience cold, clammy skin. So if you touch the skin of the mother, it's cold and nagkakaroon siya ng perspiration. Okay? And then the mother also suffers from hypothermia or mababa ang kanyang temperature. The mother will also experience dizziness or lightheadedness. Sasabi niya, sir, medyo maulaw na. That is also a sign of postpartum bleeding. Baka agpadpadara ni mother rin because there are limited amount of blood going to the brain. So kaya siya nahihirapan na ding mag-balance or nagkakaroon na siya ng dizziness or lightheadedness. Aside from that, meron din siyang decreased urine output, I should say. So, konti na lang yung naiihi ni mother. The normal urine output per hour is 30 to 60 ml. Pero yung nanay mo halos hindi na umiihi. Anong ibig sabihin? Baka meron na siyang blood loss. Konti na lang kasi yung nagsisirculate na dugo, kaya konti na din yung kanyang urine na nailalabas because of the limited amount of blood going to the kidneys and the urinary bladder of the patient. So what do we do in cases of excessive bleeding or PPH? Number 1 is stimulate the uterus to contract. Lagi nating sinasabi yan, dapat nagko-contract lagi si uterus to prevent bleeding. So how do we do that? We rub the uterus using the two-handed pressure method, and we apply firm pressure on the relaxed uterus, which will cause the uterine muscles to contract, thereby stopping the bleeding. So massaging the uterus is considered a life-saving measure for patients with excessive bleeding. Next, we can also provide cold compress to the mother. Pwede tayong kumuha ng cold dogs or mga ice, mga yelo, and then we just cover it with a towel or a handkerchief, and then you apply it on the abdomen of the mother. Pansinin nyo po kasi, if you are exposed to cold, what happens with your muscles is nagko-contract siya. So if you apply cold to the abdomen of the mother, yung uterus po na makakaramdam ng ginaw or lamig is magko-contract din. So applying ice pack on the mother's abdomen may stimulate the relaxed uterus to contract. And remember that cold temperatures can also cause vasoconstriction. So ibig sabihin, magkuklose yung mga blood vessels. Vasoconstriction. Thereby restricting blood flow and also decreasing the amount of blood lost. So ganyan po yung tinatawag nating two-hand technique. Dalawang kamay ang gagamitin natin. The first one will hold the corpus or the body of the uterus, while the other hand will stimulate the active segment of the uterus, which is the fundus. So yung isa, iho-hold yung katawan ng matres. Yung isa naman is kikilitiin or imamassage yung taas na bahagi ng uterus or the fundus of the uterus. So this is the kind of ice compress or ice pack that we can give to the patient if the patient is inside the hospital. Pero pag nandun lang siya sa bahay, we can just get ice cubes or yung mga malalaking bloke ng ice. Basta balutin na lang natin yun ng towel or linen. That can also be used to combat excessive bleeding. Ano pa? Ang medical management natin for excessive bleeding. We can also start breastfeeding immediately. Like I said a while ago, if you touch the nipple of a woman, magkakaroon siya ng contraction of the uterus. So what do? We let the baby suck on the breast of the mother. The contractions that expel the milk will also cause the uterus to contract. This process is what we call your let-down reflex. Tatandaan nyo lagi ito ha, let-down reflex. Anong nangyayari pag nagsasak yung bata? By sucking the breast of the mother, the baby triggers the tiny nerve endings in the nipple. May mga nerve endings kasi doon sa nipple, and they will now cause the anterior pituitary gland to produce hormone that releases in the mother's bloodstream. Yung isang hormone po na maproproduce during your sucking, okay, is what we call the prolactin. Yung prolactin po ang milk-making tissue na milk-making hormone na mag-stimulate sa breast ng nanay to produce milk. So pag nagsak yung bata, mas-stimulate si anterior pituitary gland. Si anterior pituitary gland magkre-create ng prolactin. Si prolactin naman, isisignal niya yung suso ng nanay na mag-produce na siya ng gatas. So that is one effect of your let-down reflex. Ano naman po yung other effect nito? Habang nagsususo yung bata, magpuproduce din yung anterior pituitary gland niya ng oxytocin. So what will happen when there is oxytocin on the body of the mother? It will push out the milk from the breast, and also your oxytocin will help in stimulating the uterus to contract, thereby stopping bleeding. So pag pinag-breast milk mo po yung bata, you are hitting two birds with one stone. One, you are stimulating the breast to produce milk. Number two, you're stimulating the uterus to contract to prevent bleeding. So napakaganda po ng breastfeeding na ina-advise natin sa mga babae, especially to those who are suffering from excessive vaginal bleeding during the third stage of labor. So yan, napaka-importante ng breastfeeding, and as midwives, we should always be breastfeeding advocates. So aside from breastfeeding, we can also transfer the patient to another healthcare facility if excessive bleeding occurs. The mother should be taken to the health facility immediately if the condition remains uncontrolled. Kunwari, nagpa-breastfeeding ka na. Kunwari, nagbigay ka na ng uterine massage. Kunwari, nagbigay ka na ng ice compress. Ginawa mo na lahat-lahat ng inyong makakaya, and yet the patient still suffers from excessive bleeding. It's time to admit to yourself that you cannot do it all. So, kailangan nang i-transfer si pasyente sa isang mas magandang hospital so that the condition will be treated immediately. So, anong gagawin mo? You also have to secure an IV. Bibigyan na natin ng swero yung nanay, and we begin fluid infusion of the plain normal saline solution or your lactated ringers solution. So, either yung swero na color green or color pink ang ibibigay natin sa pasyente na merong excessive vaginal bleeding. Bakit ulit tayo magbibigay ng swero? Kasi kailangan natin ng conduit for immediate blood transfusion. So marami kasing nawalang dugo si nanay, kaya bibigyan natin siya ng IV para merong dadaanan po yung blood transfusion para po makontrol natin yung vaginal bleeding. Now, always remember that midwives are allowed to perform IV insertion in patients with obstetrical emergencies if and only if they have undergone training. So, sir, pwede po bang magbigay ng swero ang mga midwives? Yes, pwedeng-pwede po. But, their patient must be obstetrical in nature. Ibig sabihin kung yung pasyente buntis, naraspa, kakatapos ng anak, may problema sa matres, pwede po siyang magbigay ng swero. But if the patient is kunwari having medical conditions like pneumonia, nagdengue, may ubot sipon na typhoid, hindi po pwedeng bigyan ni midwife yung pasyente ng swero because the condition is not obstetrical or gynecological in nature. So kahit gaano ka kagaling na magswero, if your patient is not obstetric or gynecologic in nature, you are not allowed by the law to insert an IVF to your patient. So ganun lang po siya kasimple. We are allowed to give IVF if and only if the patient is obstetric or gynecologic emergency. Another medical management for excessive bleeding is giving uterotonic drugs as per doctor's order. I would just like to emphasize on the term as per doctor's order. Okay? So kahit alam mo po yung mga gamot na ibibigay sa pasyenteng may bleeding, kasi tinuro na sa school ninyo yon, you are not allowed to give medications to your patient if it was not advised or prescribed by the doctor. Kahit anong gamot yan kesa hodang vitamin C, iron supplement lang, hindi ka po pwedeng mag-prescribe ng gamot or magbigay ng gamot even without, if the doctor has no order. Okay? So ano yung ibibigay nating gamot sa mga pasyenteng merong excessive bleeding? We can give the second dose of oxytocin 10 international units via IM. I-injection natin yung oxytocin 10 international units sa deltoid muscle ng pasyente, or we can also give what we call misoprostol 400 micrograms, or popularly it's named Cytotec. Yung misoprostol, ang pinaka-popular na brand niya is Cytotec. We can give it via suppository. So we can push gently the tablets on the rectum of the mother. I-insert natin po yung gamot, yung tablet na to, sa puwet ng nanay. 400 micrograms of misoprostol Cytotec is inserted in the rectum of the mother using suppository, or kung ayaw naman ng nanay, so kung kunwari sasabi niya, sir, hindi po ako komportable na mag-suppository, ayaw ko pong natatouch yung puwet ko, you can do sublingual. Ilalagay mo lang po yung mga tablets at the bottom part of the tongue of the pasyente. Sa baba po ng dila, pwede nating ilagay yung gamot kung ayaw ng pasyente sa suppository. So again, we can give oxytocin 10 international units via injection, IM. And we can also give the second dose of misoprostol Cytotec 400 micrograms using suppository or sublingually. Now, ano bang silbi kasi ni oxytocin at ni misoprostol Cytotec? These drugs promote uterine contraction to prevent bleeding. However, make it a point to always check the doctor's order before giving the medication to the patient. Kasi kung mali yung binigay mong gamot or masyadong maraming gamot ang naibigay mo, that can cause even greater problem to the patient. So dapat check yung gamot na ibibigay, check yung dosage, tama yung pasyente, tama yung route. You have to check for the different rights before giving the medication to the patient. Now, midwives are not allowed to give drugs to the patient without the doctor's order. Laging tataandaan yan. The patients can sue you. Pwede kang kasuhan kung nagbibigay ka ng gamot without a doctor's order. And that is what we call medical malpractice. Going beyond your responsibility that is allowed by law. Okay. Now, another medical management for excessive bleeding is inspecting for lacerations. Baka naman po hindi nanggagaling sa matres yung bleeding ng nanay. Baka po siya nanggagaling sa torn muscles on the vagina during vaginal delivery. So sometimes, bleeding may occur even if the uterus is already contracted or firm. So pag tinignan mo po yung bleeding ng pasyente, meron pa rin, and then you check for the uterus, hindi naman nakarelax si uterus, baka ang meron sa pasyente mo is vaginal laceration or postpartum lacerations. If this is the case, the bleeding may be caused by torn perineum. Pwedeng yung perineum ay napunit, pwede ding torn vagina, or pwede ding yung cervix naman ang nagkaroon ng tearing or laceration. This condition now is what we generally call postpartum laceration. Kung any laceration na nangyari during the delivery of the mother, that is what we call postpartum laceration. Now, postpartum lacerations are also one of the complications of the third stage of labor. Pwedeng sobrang laki ng bata, kaya nagkaroon ng laceration sa vagina, or pwedeng biglang umiri ng malakas si mother na hindi na control ni midwife yung paglabas, so tendency na punit yung puwerta ng nanay. So those are the complications also happening on the third stage of labor. So ganito po yung itsura ng may punit na puwerta. Pwedeng tamaan din yung kanyang anus or pwedeng hanggang doon lang sa perineum. So it depends on the type of laceration according to the degree. All right. Now, postpartum lacerations are injuries or tears that occur in the vaginal canal. It can also occur in the cervix or it can also occur in the perineum as a result of the delivery of the infant. Usually, in this kind of bleeding, yung pagdugo po ay constant, meaning tuloy-tuloy. And it also is a slow trickle, meaning inayad when basi-basit tirumrumwar nga dara. This is how we separate or differentiate postpartum laceration from uterine bleeding. Pag yung dugo po na lumalabas is gushing, tuloy-tuloy, pero madami, the bleeding may be coming from the uterus. Pero pag yung bleeding naman is constant, tuloy-tuloy, pero slow trickle, basi-basit lang ngarumrumwar, that is postpartum laceration. The blood is usually bright red and thin. Okay? So makikita mo yung dugo, fresh bleeding talaga. Okay? These lacerations can be categorized according to their location and extent of damage. So what are the categories of lacerations according to location? Number 1 is your anterior laceration, coming from the word anterior, meaning taas. So these kinds of laceration occur on the upper half of the vagina. So ano yung usually tinatamaan dito? It can involve the labia majora, labia minora. It can also involve the anterior vagina, the urethra, or clitoris. So incidentally, itong mga to nakikita natin sa upper aspect of the vagina or the female vulva. Meron din po tayong tinatawag na posterior laceration. These are seen in the lower half of the female vagina. At ano naman po yung mga involved na organs dito? It involves the posterior vaginal wall, pwedeng yung perineal muscle mo or yung muscle which is located in between the vagina and the anus. Yun po yung tinatawag nating perineum, pwedeng doon po nag-uukor, or pwede ding kasama mismo yung anal sphincter or in Ilocano, medyo mismo po riit, mapisang pay. So those are your posterior laceration and anterior laceration. So when you report lacerations to the doctor, be sure na kompleto na dapat yung detail mo. So example, doctor, patient X is positive with posterior lacerations involving the anal sphincter. So dapat ganun po kakompleto tayo nagre-report. Binibigay na natin sa doktor kung anong klaseng laceration yon, kung saan siya makikita, so that the doctor will immediately know what treatment to decide upon for the patient. So ganito po yung itsura. Kunwari, this is the vagina, di ba? Pag yung mga sugat po ay located dito sa taas, clitoris, labia majora minora, forceps, urethra, pag nandito po yung mga sugat, they are called your anterior laceration. Pero pag yung mga sugat naman or laceration, they occur below or on the bottom aspect, dito po sa forceps din dito sa baba, kasama din si anus or rectum, those are considered posterior lacerations. Now, meron din tayong types of lacerations according to the degree. Okay? So, number 1 is your first degree laceration. These lacerations involve only the vaginal mucosa and the connective tissue. So ang involved lang po dito sa sugat na to is only the skin and the vagina. So ibig sabihin very shallow lang, superficial lang yung sugat. Generally, these types of lacerations are not sutured anymore. Hindi na po siya tinatahi because they can heal on their own without any medical intervention. Sir, bakit hindi na siya tinatahi? Kasi maliit lang naman po yung sugat. Shallow lang naman po. It only involves the vagina and the mucosa. So mag-heal na yan after 3 to 5 days kahit hindi na natin tahiin. The next kind of laceration is what we call the second degree laceration. Ano pong nangyayari dito? This kind of laceration involves damage beyond the vaginal walls and the fourchette into the connective tissue and the underlying muscles. So kung kanina po, skin lang and the connective tissues lang, dito po kasama na din po yung fourchette, kasama na din yung connective tissues along with the muscles. So sir, kailangan na po ba dito ng suturing? Yes, we already have to suture these kinds of laceration. Kasi pag yung sugat umabot na po sa muscle, ibig sabihin meron ng kasamang blood vessel na natamaan. At pag hindi natin sinuture yon, dire-diretso po ang bleeding na mangyayari. Alright. So pag first degree, hanggang dito lang, very shallow. Pag second degree po, kasama na po yung muscles dito. Okay? So these are your second degree laceration. First degree naman dito, pag very shallow lang siya or mababaw lang. Pero pag hanggang dito, ang sugat, second degree na po. Now we also have another type of laceration which we call the third degree laceration. This involves the damage beyond the vaginal walls and the fourchette, and it also involves the perineal tissues and even extends into the anal sphincter. But this type of laceration does not yet involve the rectum. You have to remember that. Okay? Maaaring kasama si anal sphincter, but in the third degree laceration, the rectum is not yet involved or hindi pa natatamaan si rectum. This type of laceration requires surgery, and the woman may also be given antibiotics to prevent infection as the laceration site is already near the anal region. Always remember po ha, na yung anus po ay maraming mga microorganisms doon because of the fecal matter or what we call the feces. So since malapit na po doon yung sugat, the mother is required to take antibiotics to prevent further infection. Next, we also have your fourth degree laceration. And this type of laceration is even worse or even deeper than the third degree laceration. And the damage extends even towards the rectum. So yung damage po dito, pupunta sa vaginal wall. It will also damage the fourchette, even the perineal tissues, anal sphincter. But this time, this fourth degree laceration will also affect the rectum. And this also requires surgical repair and the woman is given antibiotics to prevent infection kasi nga malapit na naman yung ating rectum sa sugat mismo. So the mother will have to take antibiotics to prevent infection. So when we look at this photo here, when we talk about the third degree laceration, it will involve the perineal muscle, the perineal tissues, and then sometimes it may also involve hanggang dito po. Okay? It can also involve the anal sphincter. Pag sinabi po nating anal sphincter, that is the muscle that opens and closes for something to pass. So, titignan nyo po yung mismong, in Ilocano, it's called puriit. Okay? This opens and closes for the fecal matter to pass properly. Now, yung mga third degree laceration, it can extend up to the anal sphincter. Okay? But when we talk about the fourth degree laceration, hindi lang po sa anus natatamaan, kundi pumupunta din po mismo sa may rectum yung sugat. So makikita nyo very deep na po yung kanilang mga lacerations. And this will require surgery along with antibiotic therapy. So those are your types of lacerations according to degree of involvement. Now the best thing that we can do to manage postpartum laceration that causes bleeding is repairing the laceration or what we call suturing of the postpartum laceration. In here, we fix the torn tissues that we see in the vulva, in the rectum. So, tatahiin natin yan using what we call chromic 2O. This suture, chromic 2O, is absorbable. So, ibig sabihin, kahit hindi mo na ipatanggal yun sa midwife, after 7 to 10 days, it will be absorbed by the body. Okay? So, sir, bakit natin kailangang isuture yung sugat sa vagina? So, we need to do that to prevent bleeding by closing or ligating the blood vessels that have been damaged during the vaginal delivery. Always remember na pag yung muscle napunit, may mga mapupunit din po doon na blood vessels. And if they continue to be open, hindi natin siya tinatahi, magbe-bleeding at magbe-bleeding yon. So we have to close or ligate these blood vessels through the use of suturing techniques. But remember that not all midwives are allowed to do suturing. Hindi po lahat ay pwedeng mag-suture na lang ng basta-basta. You need to be equipped with proper skills training so that you will be allowed by the law to perform obstetrical suturing. Kasi kahit gagaano ka kagaling mag-suture, kung wala ka namang certification or wala ka namang training, you are not allowed by the law at pwede kang kasuhan. And that is what we call medical malpractice or going beyond your responsibility. So always remember ha, magsusuture tayo gamit ang chromic 2O, which is an absorbable suture para i-close yung mga blood vessels, pero kailangan natin ng proper skills training bago natin gawin yon. Alright, so the general principles of perineal repair and IV insertion will be discussed at length during the IVTs and suturing skills training. So I will not be showing you the different techniques of suturing kasi meron pong separate na training para sa mga estudyante namin at tayo po ay magtatahi at mag-IV insertion sa mga magiging classmates nyo. Okay, so you will learn about perineal repair and IV insertion more during your IVT and suturing skills training. So I wish that you all stick around, gawin nyo ang inyong mga assignments and activities and quizzes, ipasa nyo lahat ng mga subject nyo so that when you reach your second year, tuturuan namin kayo kung paano mag-suture at paano magkabit ng swero. Alright, so ganyan po yung ginagawa natin during your perineal lacerations. Yung suture po, ang tinatawag natin in Ilocano is the panait. Okay? Those are what we call sutures. Ang suture po na ginagamit natin is chromic 2O. Okay? Chromic. Malalaman nyo ito during your skills training. Chromic 2O 2.0. So, yun po. And that concludes our third pre-recorded video lecture on the common obstetrical emergencies on the third stage of labor. I hope you enjoyed the class as much as I did. I'll have to make an assessment again and a quiz will be uploaded on your Edmodo, or for those of you who have not yet entered our Edmodo classroom, I will send it to you via Facebook Messenger. Again, maraming salamat for listening and keep your distance, wear a mask, wash your hands, stay healthy, and stay alive. Maraming salamat po.